You know, health is not just about movement and nutrition and lifestyle. It's what are we listening to? What are we talking about? What are you viewing with your eyes? And your brain takes all of that in, and our brain in this ultra modern world, we are overstimulated, and that's driving a lot of symptoms.
We have seen a massive change in healthcare over the past 10 years. We've seen an increased number of people being diagnosed with diabetes, heart disease, but we have the opportunity to change that. I'm Dr. Brittany with Lakefit Chiropractic. I'm here with Sarah, a functional health coach, and we're going to go over some of the questions that we see commonly with our patients and with your clients. So let's get started. What is a functional health coach?
It's a great question, and I feel that it gets confused out there because there are so many different terms like personal trainer, health coach, nutritionist, dietitian. So really diving in and dissecting each one, I think it's important to understand, because that's the service that you're going to get, and it can often get confused. With a health and nutrition coach, what we're looking at specifically at the SF coaching method is movement. We're looking at, movement outside of exercise. We're looking at training. We're looking at cardio. We're looking at lifestyle, which is 90% of the diseases that are driven right now. And we're looking at nutrition. We're looking at well-being as a whole. And so it kind of encompasses the entire well-being of a person, rather than just focusing on something like training, which would be personal training, or even nutrition, which would be just nutrition. So we're looking at everything as a whole body and how all systems work together.
Integration.
Awesome.
All right. So when we're looking at all the people out there, who's your ideal client?
Well, it's changed over the years, and a lot of that has changed as I've changed in age, and of course as we've grown in our experience. So our ideal client here today and who aligns with us are people who are looking for preventative health, alignment in health span, lifespan, and understanding how to prevent the lifestyle diseases and live a long time and have a good quality of life.
So as you start working with these people, what are the common struggles that they see across their journey?
Yeah, a ton of struggles, and I think it matters what age. And what I see the most in the 20s and 30s are people trying to improve body composition. Maybe they're trying to compete in a show or a triathlon, many different sports. But what's funny is what we see is all of the decisions that are made in the late teens and in the 20s, once we reach that age of mid-30s, that 35, this is where we really start seeing the consequences of a lot of the decisions come out, like autoimmunity, autoimmune issues, IBS, digestion, endometriosis, and inflammatory lifestyle-driven diseases. We see that 35 and over, and then once we get to 40 and above, we're fighting perimenopause, decline of hormones, which could really start looking like depression, anxiety, and it's confusing. We can intervene with movement, lifestyle, and nutrition and fix and reverse a lot of what's going on, but I think a better understanding of it is necessary.
Yeah, I think people need to take a step back and evaluate what decisions have they made, and what's their goal going forward. So if there's one way for people to start improving their health, what would be the first thing or the biggest thing that they could look at and address?
Well, I love that question, and I think that human nature is we always want to add something. So to start, let's start training, or let's start buying different foods. But it is human nature to want to add all the time, and I always guide my clients, what can we subtract? Because if we can subtract some of what's driving the illness or driving the symptoms that you're dealing with, subtracting looks like, what are we as a society? We're overcommitted, we're running in the matrix, we're not present, we have anxiety because we're living in the future, we have trauma and we're living in the past. So to bring yourself to the present time and say, let's take a look at my schedule, let's take a look at my life, what can I subtract to improve my life? That's where I would start.
And I think too, something that comes to mind is another S word is substitute. You've got, again, a full day schedule. All right, rather than scrolling,
yes,
can we substitute with something more productive like meditation or going for a walk or something like that? So,
and habit stack those things. So let's go for a walk and meditate. Let's do a walking meditation, and at the same time, you could listen to a podcast. Health is not just about movement and nutrition and lifestyle. It's what are we listening to? What are we talking about? What are you viewing with your eyes? And your brain takes all of that in, and our brain in this ultra modern world, we are overstimulated, and that's driving a lot of symptoms.
There's definitely something to be said for movement outside, or
Absolutely.
going outside.
Nature.
Yeah.
Sunlight.
So you mentioned habits, and if people are trying to change habits, They can start by substituting or subtracting. Any other suggestions in that trying to form a habit?
I would start with the least effective dose. If you are somebody who is sedentary and you're not moving at all, it's probably not realistic to say, let's add 5 days of training on top of our already overcommitted lifestyle. So I would say start with the least effective dose and start with something that you can do on your worst day. If you're having the worst day and you have really high stress and maybe you don't feel good, what could you do? Could you go outside and walk for 8 minutes? Could you meditate for 5 minutes? And I would say, if you can do it on your worst day, that's probably a habit that's going to stick and that would be consistent. And I would start building and stacking wins and putting those in your pocket.
Fundamental building blocks, like you said, habit stacking. So if we were to jump over to more the nutrition side of things, a healthy diet, what's like the biggest misconception that you've heard, seen? What do you keep coming across with people?
Well, there's so much misinformation and there's so many things to watch on social media platforms and so many different cooks in the kitchen, if you will. And when it comes to nutrition, we overcomplicate it. If we look at fruits and vegetables, and if we look at increasing protein, this is going to be what really offsets a lot of deficiencies and a lot of symptoms, again, that people are dealing with. So let's stick on protein for a second. What I see the most in my coaching experience with our clients is most every American is on the SAD diet, and that's the standard American diet. You're seeing high carbohydrates, mostly highly processed, high fats, again, very high processed foods, and low protein. And when you have that trifecta, you are going to have symptoms and disease, and you're going to have osteopenia and osteoporosis, and you're going to be dealing with things that may not be today that you're dealing with them, but they will show up further down the road. So I think that we are a society that is under-muscled. We are not eating enough protein, and there's just so much highly processed foods on the shelves. And it's hard because the marketing can be so scary, right? It's natural this and organic that, and do I get cage-free or do I get pasture-raised? And so really investing in some education around that, I think would be beneficial, and in the long term, financially a good investment, because you're going to pay the price metabolically. You're going to pay back that interest at some point in your life.
Yeah, some people, being healthy is expensive.
Yeah.
Try being sick.
Yes.
And that is equally and or more.
And I love that. And I also feel that what's more difficult than setting an alarm? What's more difficult than training when you don't feel like it or when you don't feel motivated? What's more difficult is living a life full of disease or symptoms or having restrictions in your movement and your quality of life coming down. So for me, I'm not always motivated. I don't always want to set the alarm, but it's a much better and a lot more ROI on that lifestyle than being sedentary and skipping over it.
I mean, risk reward, right? I mean, the risk is distant and you don't see it or feel it, but the reward in a day, in 2 days, in 4 days of doing these small habit stacking things, you're gonna see positive change.
And what I would add to that is no endpoint. So a lot of people, when they start a 6-week challenge, I'm going to join a gym, they already have 75 hard. I already have an endpoint in mind, but there is no destination. There is no final destination with health. Once you have the transformation that you want, or even body composition you want, you actually have to continue those habits to keep it. So I would add that as well.
Yeah. So that's like the newest and latest, I would say, conversation is things along longevity and, living a longer, healthier life. Right now, I guess this is what we've been talking about, right? Is we want to talk about what's the best thing we can do for a longer, healthier life. Well, start now. The best day would have been yesterday.
Yes.
But the next best day is now.
Absolutely.
So.
And I would add to the lifespan and the health span. For me specifically, health span is first and lifespan is second, because I'm not sure that I want to live as long as I can if my quality of life is poor. So for me, there's even a priority list in those statements.
So in our office, we have a poster and it says to die young as late as possible.
Yeah, I love that.
So again, is there one thing to say longevity, longer and healthier? What would be? Can you, right? But one thing.
I think small things, and what are the barriers always here? Whether it's an investment or a time constraint, if you can just get outside, if you can be in nature more, if you can be less stimulated and less scrolling and less screen time, more natural light, the morning light, whether it be thyroid or whatever it is we're talking about, if you get outside and you get that sunlight on your body, that is right there a free hormone reset.
There we go. There we go.
A free thyroid reset. And so what we're really missing is, we've been around so long and it's so great that technology has advanced, but we've gotten away from the basics that keep us living a long time and living a good quality of life.
So, we talk about some nutrition, and if we switch over to more of the movement and fitness side of things. Common question: what's better for weight loss, cardio or strength training?
Well, I'm gonna push back a little bit on that one, and I would say fat loss, because I think people get weight loss and fat loss confused. They're so obsessed, and we've been conditioned to see the number on the scale go down. Well, yes, that's weight loss, but what would that include? That would include some lean mass, potentially muscle, water, inflammation, and not that all those are negatives, but it's very different than fat loss. And I think that can give, especially women, a really mentally tough space to live in. So if we talk about fat loss specifically, it's strength training all day long, even though women have mostly been conditioned to believe cardio, or I'm gonna eat something that maybe in my eyes I deem as bad food, and the next day I'm just gonna stay on the treadmill longer. Well, one, that's not how fat loss works. Two, that's probably a pretty poor relationship that you have with nutrition and with yourself. And I would say that fat loss, number one, strength training, you can't get away from it. That is number one. And if you want I always tell my clients, strength training is going to offset disease. It's going to give you insulin sensitivity and keep you away from being insulin resistant. And it's going to give you the shape of the body that you want. It doesn't matter what you weigh. Muscle is dense. It's going to weigh more. But people look at somebody who is strength training and they think, I want to be smaller, and they correlate that with the scale going down.
Yeah, no, you'll see your clothes fit different, and you're gonna have more energy.
Yes.
And the number on the scale still hasn't changed.
Right.
So it's being patient, because over time, commitment, consistency.
Right.
It will come. If it's a goal, but again, you're looking at what do you want though? The fat loss, the body composition, and those things are, not directly correlated with the scale.
Absolutely. And I think a big misconception is the length of time that would take. Again, no end point, and it's not going to happen in 4 weeks. Most transformations I share with my clients, they take 8 months, 1 year, 2 years to really get and nail down not only earning the transformation, but keeping it.
Yeah, owning that.
Yes.
New habit patterns. So what's coming up with Sarah Effective Functional Training? What's coming up?
Well, we have a lot of things that we're launching this year. We did just launch a brand new website that is both friendly for users who are training with us in person at the gym or online with coaching. And this year we'll be giving education opportunities. So we're composing a 12-week women's health education course. What I've learned over time coaching women in functional health is that most women do not have education around their menstrual cycle, around how their body works, the thyroid, the systems, how they are integrated and work together. And I think the expectation is that our doctor is going to inform or educate us. Now, we need conventional medicine. Conventional medicine is good. However, what they do is they diagnose and they treat the symptoms. So they will wait until you have diabetes before they treat it, because that's their business. And I think we need to understand that, let go of maybe even some of the blame there, and think, okay, how can I take ownership over my own life, my own habits, and how am I responsible for preventative health care? And I think that's the first step.
All right. So if you know somebody that's trying to work on their health habits, if you're interested in functional health, Sarah's got some great answers for you. Reach out. She's on Instagram, sarahfector.ippbbpro. Find her, ask her questions, and we are at Lake Effect Chiropractic. If you've got any musculoskeletal complaints, thanks for listening, and reach out if you have any questions for us.